And it is 1:30. I'll ask the clerk first. Are we ready to go?
Arenas,
Here.
Jones, Mahan,
Here.
Jimenez, Perales.
Here.
Thank you.
Thank you, Yasmin. And sorry, I was just asking if you were ready, but you are ready. So, and that was roll call. And thank you. And welcome everybody. We are calling this meeting to order, the Public Safety Finance and Strategic Support Committee. We do have a quorum. And if you are joining us in today by Zoom, remember you can use the raise hand function to participate. Or if you're calling in, you'll have to use the *9 button or *9 function to raise your hand. We will now go to the review of our work plan. And do I have any recommendations from my committee members on the work plan? Not seeing or hearing none. We have no changes to the work plan. And none from staff in the recommendation. We'll move down to the consent calendar. And we do have one item on consent. I will go to members of the public on the consent calendar. And again, you can raise your hand on Zoom or press *9 and you will have 2 minutes, and I'll turn it over to Tessa. And this is on our consent calendar, Tessa.
Right.
And we have one item, which is the first quarter financial reports for fiscal year 2021-2022.
Okay, good. Excellent. Good job, Raul. Thank you, sweetheart. And for keeping us informed and helping us be better students of democracy. Thank you. Okay, good. So basically the first quarter, and there it is. I love that sign. That even helps us. First quarter financial reports. Well, you know, money and the way money is spent is very critical of our values. And so we have to look at how we're spending our money. And the thing is that this is where the real changes need to come in our community, which I appreciate that the city of San Jose has decided to really protect our health, protect us, because this is this department that we're, you know, this meeting is about public safety. And so what we're talking about in terms of safety in regards to our climate crisis. And that the city has said that we will go carbon neutral. But the thing that needs to happen and change in our city is just like we have the police dealing with, you know, safety. We think that's their ball of wax, as they say. Well, what it is that in order for us to really go to zero, to create the safety that we need, because we see the risks that are happening in our society. We're seeing what's happening up in Canada, and also it's been a state of emergency, the state of Washington, the floods, the fires, and all these issues that are coming our way. And, you know, that we need to be prepared. And what it is listening to the science. So what I'm trying to say in terms of our values and our money, where it goes, is we need to listen to the science and how to get us to zero fossil fuels. So that's the change. And that's what Extinction Rebellion says, that we need a citizens committee that is made up of the scientists to bring us to zero. And that's how we will get the true, you know, safety that we need as a community.
Okay, thank you. And I did see another hand go up, Blair Beekman.
Hi, thank you. I just wanted to try to quickly offer that it was really nicely mentioned at a retirement planning pension board meeting at the beginning of this year, this past year. And there was a nice lecture by a fairly regular person who was at retirement board meetings, that there can be practices that can avoid inflationary budget planning for the next, for at least for this year. And it was really an interesting idea. And it was noted, and it was also noted by the chair at the time, that there is there's other considerations they have to consider. They were raising, the salaries of
Blair, we're having a lot of trouble hearing you. There's a lot of something.
noise. Okay,
Yeah,
I'll
noise.
quickly conclude. I'll try to quickly conclude that just he offered some good advice. I don't want to blame the police, but just to note that there was a lot of factors at the beginning of the year. We could have done things a little differently, so no one could be blamed for these inflationary patterns we're now currently in. Good luck how we can listen better in 2022 and into the future for a budget idea. Thank you.
All right, thank you. That'll conclude our public comment. I'll bring it back to members of the committee, and if I can ask for a motion to approve.
Motion to approve.
Second.
Okay, if we can get a roll call vote, please.
Arenas,
Yes.
Mahan,
Aye.
Morales.
Yes.
Thank you.
All right, thank you. The motion
I
passes.
don't know if I was called the,
You
Chair,
were
but-
not. You were not. You got skipped over. Sorry.
yes.
And Jimenez.
All right,
Yes,
motion passes unanimously with the members that are present. That was our consent. We'll now move on to item D1. This is our reports to committee. The Police Department Operations and Performance Bi-Monthly Status Report will be first. And I'll welcome up. We have a number of representatives from our police department that are here. And I think maybe Lieutenant Donahue, are you taking it over?
Yes, I am, sir.
All right, take it away.
All right. Can you see my screen?
Yes.
Excellent. All right. Thank you and good afternoon. My name is Lieutenant Steve Donahue, and I'm the commander of the Research and Development Unit of the San Jose Police Department. And today I'll be presenting the police department's bi-monthly operations and performance status report. We'll be covering Part 1, citywide crime statistics, and then we'll present on other matters of interest, including the gender-based violence response and strategy work plan update, and a brief update on redistricting efforts. And finally, Sergeant Denise McMullen will speak about the mobile crisis assessment team. We'll begin with our citywide Part 1 UCR crime stats. As you can see, UCR defined rapes are up almost 25% in 2021 compared to the same period in 2020. And as I presented in the last bi-monthly report, the deeper dive into this number showed it was due to the efficacy of the intersectionality tool, with more historical rapes being reported by survivors of domestic violence. In addition, aggravated assaults are up 12% compared to the same period in 2020. And this is a nationwide trend we're experiencing after the opening of COVID. Our assaults unit is looking for patterns and hotspots as we find innovative ways to positively affect this number. Our property offenses are down, with another significant decrease of 11% in larceny. And overall, we're looking at a 5% reduction in crime when compared to the first 3 quarters of this year to the same period in 2020. Now we will move on to our gender-based violence response and strategy work plan update. When we look at rape offenses during this period compared to the prior 4 years, we see an overall increase in rape offenses by 22%. And on its face, this number is alarming. But when we dive deeper into the numbers, we see the biggest increases in spousal rape, rape, and domestic attempted sexual assault. Now, we're able to attribute these increases to the effectiveness of our intersectionality tool, ensuring every reporting survivor of domestic violence is asked about sexual assault. Very soon, this intersectionality tool will actually be a 3-way interaction between survivors of domestic violence, sexual assault, and human trafficking, meaning that a survivor of domestic violence will be asked both about sexual assault and human trafficking. Likewise, a human trafficking survivor would be asked about domestic violence, sexual assault, etc. These charts show the current status of both the city and county-wide work items since the inception of the work plan. Now, as you can see, we added 2 components to the San Jose specific work items. The 3-direction intersectionality tool is in progress. Now, the draft policy is completed, the form is completed, and the updates to our reporting software are completed. However, at this time, we're only waiting on the forms from the printer to be able to implement this work item. Once those arrive, we'll get this off the ground. We also added a report back to this committee in February regarding the intersection between firearms and domestic violence. When we look at the county specific items, the most significant update is the joint city-county meeting that occurred on November 5th. Updates from that meeting will be presented at the next Gender-Based Violence Response and Strategy Annual Report. Regarding the Sexual Assault Bill of Rights, you'll notice we now have a check mark in the duty manual section portion of the Bill of Rights. On October 22nd, we completed a major revision of the sexual assault sections in the duty manual. This revision changed the term victim to survivor throughout. It added sections regarding mandatory reporting, notification of the Sexual Assault Bill of Rights, and the right to have an advocate or support person present. It also changed the existing sections on non-investigative reports, collection of evidence, juvenile statements, and consent for safe exams by or for minors to our best practices. The final prong of this item, the new resource card, is still in process. The new card is completed and is at the printers as well. And when we receive it, we'll begin its distribution. During the July through August time period, there were 37 qualified adult safe exams and 28 qualified juvenile safes. Of those 65 qualified exams, we saw 42 individuals move forward with the exam. And now we'll move on to redistricting. There are no major changes to the phase of redistricting at this time. The second draft of the RFP is completed and is currently being reviewed by stakeholders. So this concludes my bi-monthly operations performance status report. At Councilmember Jimenez's request from the last meeting, I'd like to pause here for any questions from the committee before we move on to the update from the mobile crisis assessment team.
All right. We'll pause
Chair.
for any question. Yeah. Go ahead, Councilmember Arenas.
So we're taking questions now and not public comment first.
We could hear. I'm happy to hear any questions
Okay.
on this item from the committee, or we could hear the rest of the report and then go to the public and come back on everything. I'm comfortable if there's some clarifying questions that want to come in now from the committee.
Okay, I'm open to your direction. So I will ask now.
Go for it.
A second, here I am. Thank you so much for that report. I was hoping that we could add, we just had a joint special meeting for gender-based violence and child sexual abuse that many of us here attended. And so part of that meeting, we had a motion at the very end, and in that there was some additional action items that I wanted to add to our work plan. And so we can do this offline. It's part of my motion. It's I think we provided that motion to Peter from the CMO's office. And I'm just hoping that we can update it so we can see it in the next bi-monthly report. Is that something that could be doable by then?
Yes, ma'am. So I received the email from Peter about the motion, and it looked like a lot of it was going back to the CAC team. We'd be happy to add that to the bi-monthly report, so you can see that on there. And then I know that you'll get a full report out on it when Lieutenant Jimenez reports back in March.
Sure.
So I think my next bi-monthly is in February, I believe. So I'll have it on there by then. That's no problem.
Okay, great. So it sounds like Lieutenant Jimenez will be the one coordinating with the CAC for our participation within those conversations with the school districts for the gaps.
Yes, ma'am.
Okay.
Yeah, it'll be Lieutenant Jimenez, and then I know Captain Matchett is involved with the school liaison unit as well.
Perfect. I think the only other one that I had was, I think I know that there's a increase in rapes and especially in domestic partner or intimate partner relationship. Is that something that you see across up and down California and across the nation as well?
So I'm unfortunately I don't have statistics on intimate partner sexual assaults across the nation. I don't have that. I'm sure we can research that. I do know that, I mentioned that this is historical, and I actually got some great information this morning. I'm sorry, last night regarding this particular question, and it showed the historical nature of reporting over time. For example, in 2019, you had asked us at the last meeting what was the percentage of late reporting? But in 2019, that was 13.4% were delayed reporting in sexual assaults. That jumped to 20% in 2020, and now it's 22.5% so far in 2021, showing that this intersectionality tool is incredibly effective and it's working with great gains in delayed reporting.
Great. Perfect. And how do we, I guess I'm trying to figure out, how do we measure that level of success with the implementation of the intersectionality tool? I realize that there's an increase because we've been I say we, but I know that you all have been doing the really hard work of asking these questions when there's a case either in human trafficking or intimate partner violence, and now will include as well a sexual assault. It'll from what you all shared with me in a debrief, all those 3 subgroups will now have additional questions asked. How will we know when? I mean, I know that we're believing, and I believe with you as well, that this increase is due to that intersectionality tool. But how do we really get to realize whether that's the thing that is really moving our numbers up, and maybe not it could certainly be also part of the pandemic and being at home and having women and children and men restricted from outside social circles.
It's a very good question, council member. So I think we could look at a few different factors. We're looking at things that we can measure. So when the intersectionality tool did not exist in 2017 and 2018, and at that time, our delayed reporting was approximately 10%. It was 10% in 2017, 10% in 2018. So when we look at that and we inject the intersectionality tool in it and the factor of COVID, but you still see an increase. You still see in 2019 an increase to 13.4% for delayed reporting. And now COVID's lifted and we're having a lot more interaction with survivors. And because they're no longer, for lack of a more eloquent term, cooped up in the house, we're able to have that question answer based on this intersectionality tool. And you're seeing a huge jump to 20%, 22.5%. We are more than double in 2020 and 2021 what it was in 2017 and 2018. So when we look at numbers, we can tell you that why else could we explain a more than double jump? It's we believe the implementation of this tool. When you look at socially, what's happening in the country from social movements like the Me Too movement and the opening up of survivors telling their story, that has to be a factor as well, but it's an immeasurable factor. Unless we were to ask survivors, hey, why did you tell us, right? And why didn't you tell us before? Then we're not going to be able to measure that particular statistic. What we can do is know based on the data that we have at hand that our tools are working and survivors are coming forward. And that, I think that's the most powerful sign, is that now we're able to reach out and communicate and connect with them in ways that obviously were not happening before.
Right. No, I agree with you. Although I have to add that certainly in living 24/7 with the perpetrator in the same household and having no outside connections would certainly be just the ripe situation for an increase in that kind of violence and escalation, which is what we've seen is that the violence has really escalated for those victims and those survivors. and so what I'm hoping to get to is um, a way to really measure this. I don't know what that is. I don't know if it's a little red flag on each of these things or a code that tells us, you know, there's out of the 100 that additional cases, 80 of those have a um, IT, because it's the intersectionality tool was utilized. I think that it merits the tracking of it, so that we can know how successful we are with it, and we could see that success, as well as with some of the the additional things that we're going to continue to do, like the card that's within the Bill of Rights. When we distribute that, that might make a huge difference that we just didn't recognize before. And it would be great to see what of those things, of the new strategies that we're using, or maybe not new, because some of this you've already been doing, maybe informally, but now we're formally keeping track of it and can formally say this intersectionality tool is working. Just how well is it working, and how are some of the things that we are implementing in our Bill of Rights, how are those working? Because if it doesn't get measured, well, you guys all know, we have to figure that piece out. And I know that there's a lot of just colloquially we figure out that the Me Too movement has created an increase in reporting, but for the city of San Jose, we've had an increase in rape for the last 8 years, and the Me Too movement has only been around maybe for the last 4 or 5. So it doesn't really explain the incremental increase in rapes, and the definition of rape was also not the sole reason of that, because whether you're raped with all the different technical forms, rape is rape, right? So anyways, I just, what I want to get down to is how do we measure this? So this is the piece, and we can take this offline, but those are my questions, Chair.
If I may, Chair.
Please.
So, Councilmember, thank you. That you bring up some excellent points about this. When you discuss the different historical changes in rape reporting over the years, I worked sexual assaults for quite a while back earlier in my career, and rape means something different, or meant something different back then, as you know. So what we find is that there's always triggers or caveats that may cause an individual to report, or allow them the space to report, if you will. I think one of the difficulties is measuring it as law enforcement. When you talk about the intersectionality tool, if I were to red flag every case that used the intersectionality tool, it would be 100%, because our officers use it 100% of the time on every single sexual assault, domestic violence, and soon to be human trafficking case. So that red flag isn't going to tell us anything. I think it's in the discussions after the fact. It's in the ability the advocates have to bond with the survivor, and then use their relationships to really kind of understand how we can move forward and develop better relationships with our survivors. Maybe this is something that can be tracked through the advocacy programs, or something that they can follow up with on the back end. While it may not necessarily provide us the opportunity when we're gathering the evidence necessary for the prosecution of the case, it could be something that we could work with our advocate partners to get off the ground. So this is definitely something we'd like to explore and kind of help down the tracks, but we need to be open to the idea that it may not be a police-related action. It may be something that we use some of our other partners in this to find that path.
Thank you.
All right. I don't see any other questions or hands raised from members of the committee, so we'll complete the rest of the presentation.
Okay, now I'm going to pass the presentation to Sergeant Denise McMullen of the Mobile Crisis Assessment Teams.
Good afternoon, council members. So we'll just get on with the presentation for the mobile crisis assessment team. Next slide. And we'll start with the history of the mobile crisis assessment team so that we can kind of get a better understanding of how this all came to be. So in 2018, there was a group of department members who saw the need to have a unit created that was made up of a dedicated group of officers who would who were specially trained, that would go out and co-respond with clinicians to individuals within the community who were dealing with mental health illnesses. This idea was brought to individuals over at the County of Behavioral Health, who thought it was also a great idea to create a co-responder team. So in 2018, the San Jose Police Department applied for a grant through the Office of Justice Program Bureau of Justice Assistance. In 2018, the department was notified that it had been awarded $750,000 to fund the co-responder program with the Santa Clara County Behavioral Health. The following year, in August of 2019, the two entities sat down together and established a MOU that outlined the roles and responsibilities for each entity. In October of 2020, the department's pilot program was commenced, and due to its success, the program was, it was decided in March of 2021 that they would move 2 sergeants and 4 officers into a temporary duty assignment where the unit currently stands today. Next slide. So the way in which the MCAT program model exists and the way in which we deploy today in the field, it's 2 ways. And that is we do in-progress events, and we also do what's considered non-urgent follow-up. So I'll talk about the in-progress events first. And the way that we do that with in-progress events is that usually we get what's called, we either generate a referral either through the MCRT community line or through a 911 call taker. An example of this would be an individual calls either for themselves or a loved one stating that they are needing assistance because they are in crisis or a family member's in crisis. That in turn would generate a request for MCAT officers and the clinicians to respond to the event. And either we would supplement officers who are already at the scene, or the team, the MCAT team and the clinicians would respond as a co-responder team. Once we are at the scene, MCAT officers and the county clinicians are able to provide support by augmenting the patrol officers by being utilized as a resource for either de-escalation, mental health assessments, and ensuring that the individual who's in crisis is connected to proper levels of care and mental health resources and services. Once that person's stabilized, we're able to create a follow-up, non-urgent follow-up will be scheduled by the MCRT clinician to ensure that the individual has service connections needed for that individual to stay on the path of support and stability. So that would bring me up to the next way in which we could be deployed, which is a non-urgent follow-up. And what that is that MCAT receives mental health referrals either by department members or community members. Once we receive those referrals, we are able to, as an MCAT member, do a threat assessment. Once that threat assessment is completed, we would send that referral over to the clinicians so that they are able to do a priority level assessment to determine when they're able to do follow-up with the MCAT team. Once that priority level is completed, they would reach out to the MCAT team, determine when they can schedule follow-up with the MCAT team. And the 2 entities would meet in the field, respond to the location together, and then they would connect, reach out to the individual in crisis, and then determine what the proper level of care and services are that individual might need in crisis. Next slide. The mobile crisis operation model, it's basically a 4-component approach. And that's basically just to ensure that we have specially trained officers and mental health clinicians who respond to calls to service. We want to also ensure that the clinicians meet MCAT officers out in the field and they handle the calls together. That MCAT officers, the teams, they respond throughout the city, and we specifically target areas of need that have the greatest mental health calls. And then we also want to ensure that this allows us to enable MCAT officers and also the clinicians the ability to appropriately link these individuals with mental illnesses to the appropriate services or provide other effective and efficient responses as needed. Next slide. The primary goals with MCAT in itself is just basically to identify individuals within the community who have a mental health need. Once that need is identified, we want to ensure the individual is connected to services and care providers. We also want to take the time to develop innovative strategies while dealing with the mental health crisis to ensure proper care is being provided during every step of the crisis. We also want to ensure that every effort is being made to establish and maintain necessary partnerships through the city, county, and community. These relationships with all these stakeholders are being made for the success of our MCAT unit. Next slide. And then obviously, you know, there's a multitude of benefits having this type of collaboration between mental health and law enforcement. But some of the ones that kind of stand out obviously are fewer uses of force. You're going to have fewer injuries to officers across the nation. These types of collaborations have been implemented through agencies all over. And these agencies have reported that based upon these implementations of these types of collaborations, they have seen a decrease in injuries to their officers. Fewer injuries to the clients. Officers who are working these types of units are able to better understand and interpret people who are in crisis. And as a result of that, they are able to respond more appropriately to these individuals who are in crisis. And as a result, you start to see a decrease in injuries to the client and themselves. And then an increase in use of services. Officers become more acclimated to the types of services that are available within their communities. And as a result of that, they are able to more appropriately provide a level of care that better suits that person in crisis when they are triaging that individual based upon the care that person may need. So it's just a better use of those different types of services within their communities. Next slide, please. So the MCAT's current staffing and operational hours are, we work 7 days per week, 10 hours per day from 10 a.m. to 8 p.m. Like I had mentioned earlier, we have 2 sergeants, 4 officers assigned TDY. Right now, we currently have 2 officers who come in each day who work overtime, and that's paid through our grant that we currently operate under. Next slide. And then these are just some stats that are been compiled just to kind of show the significance of the MCAT program and how successful it's been. And more importantly, it just kind of shows, if you can see from January to September, the increase, January to March, we had 135 referrals, 98 field visits, 18 15-150s, and 37 patrol assists. But if you kind of fast forward to July and September, they've more than quadrupled. We've had 239 referrals, 198 field visits, 44 51-50s, and 133 patrol assists. But the thing that stands out more importantly to me as a supervisor of this unit is that of the 600 contacts that we've had since the program's been implemented, we've had 0 uses of force, which I think says a lot in regards to the program in itself. Next slide. So with every pilot program, obviously there's always challenges, and these are just some of the challenges that MCAT faces, you know, it's like I had mentioned, it is a pilot program. Staffing is always a challenge with any new program. So staffing right now, we currently have 2 sergeants, 4 officers. We are implemented every day, like I had mentioned, with 2 officers who work overtime. Vehicles, we currently use repurposed CSO vehicles. The vehicles are small, very confined, and not equipped to do transport. So we do rely on either EMS to do our transports, or we have to call for patrol to do some transports for us. And then obviously budgeting, we do rely on grant money to provide our funding. As it mentions here in the slide, our grant that we currently rely on was until December 21st or December of 2021. However, we did get our grant extended. So we are currently going to be good until December of 2022 for that grant. So, but we do rely on grant money to kind of fund this program as of right now. That concludes my presentation, and I am open for any questions.
Thank you very much. I'll have a couple questions, but I will go to, now that we're done with all the presentations, I'll go to our public and then we'll come back. So first up, went away here. First up, we have Tessa Woodmansey.
Thank you, Tessa Woodmansey. Well, great job. You know, it was exciting to hear about, I don't know if the word is exciting, but it was nice to hear about this MCAT in regards to, you know, crisis assessment team, and, you know, that we have those type of facilities. Because what I'm seeing in my neighborhood, because I live on Stockton Avenue and I see homelessness, you know, there was a man who was sleeping on my little bench outside my house. And so, you know, it was 2 a.m. I called the police, even though it was, my husband said, let's just call for a, what they call a, you know, a wellness check. Cause I said, okay, don't bring your guns, nothing's a problem. And, you know, and they asked me if they wanted him to move. And I said, yeah, that would be nice. So, you know, in the morning, he ended up being in front of the commercial place where they're planning a hotel where there's a parking lot. And, you know, the thing is that I see that we need to transition into this model of care, and that we're not moving really quick enough, because like I was trying to say when I called about that, and there's been other times where there's a woman who's screaming and yelling and throwing glass in our neighborhood. And, you know, I called the police, and they said they came over and they didn't do anything, because they asked her, do you need help? And she said, no. You know, and this is where there's a problem. And they tried to explain to me that there was nothing they could do. But obviously she was yelling and screaming and throwing grass, and she was a homeless person. And, you know, and so it's like, how do we be more engaged to problem solve? You know, like they were saying, resource and referral. And I think we really got to, and at this time of night, it was 11, so there was no health care, you know, or, you know, urgency care. And I think we need to call those in to really solve the problems, versus in both those situations, nothing happened to those homeless people. And I think we need to be more engaged to problem solve as the problems come up, versus just, you know, moving them along or saying, do you need help?
All right, next up will be caller ending on the last 4 digits of 4379. And you'll have to
Hi,
press, yeah, *9. Sorry. Oh, sorry, *6. Go ahead.
Okay, so I just wanted to thank Lieutenant Donahue for pointing out the alarming rape increase is largely due to domestic violence issues. These are serious and not to diminish, but you know, the mayor was gaslighting me, saying that this is one of the reasons why we need 10 additional officers for 3 years with the ARP COVID funding. As far as I know, these officers of the downtown foot patrol that's being proposed won't be able to help with stopping these domestic related rape incidents. There's no nexus, and I think there's a better use of that ARP funding to help bring down these rape cases. I'm happy to hear about the early MCAT team success. Just for context, in 2019 and 2020, from city data, the use of force rate was across all types of interactions was about 0.2%, or about 1 use of force for every 520 contacts. So it looks promising that 600 contacts so far with this MCAT team and no uses of force. I'm happy to hear that the grant was extended to December 2022. But I think it's incredibly important in discussing this ARP funding and 10 officers for 3 years at $6 million. And that's only one-time funding. We're going to have to find ongoing funding when we have a structural deficit in the budget currently. And seeing that this MCAT team has a stated challenge of staffing and lack of a local ongoing funding source beyond next year, I think it's incredibly important to prioritize funding for this effort as opposed to the 10 cops for a downtown foot patrol. Reimagining policing is a big effort by the city, or at least that's what's said. And this is a perfect effort that I think the community is looking for. And so it seems like we should be going in this direction rather than trying to add a downtown foot patrol to bring down domestic rape cases. It just doesn't add up. So thanks for the presentation. And yeah, that's it. Thank you.
Thank you. Our next speaker will be Blair Beekman.
Hi, thank you. Hopefully I've turned my mic around and you can hear me better at this time. Thank you very much for the words of the previous speaker. Paul and I were asking that question yesterday at public record time. For officers, more officers on foot patrol for rape cases in downtown does not make much sense. And I had asked, can we look at what are the criminal statistics and what's happening at the crime issues in the downtown at this time? Can you make that a public meeting agenda item soon? And to get a kind of a better understanding of the situation. For this item, thank you very much. That it's nice to hear that people are reporting more, women are reporting more. That's a real hopeful sign. It's not so hopeful that the amounts of rape have gone up, about 4 or 5 times a month, at least in the past year. What Tessa had mentioned about working in constructive terms. Good luck how, with the success of people learning how they can talk about the issue more. How can that be of help to ask how we end this current rise in rape in San Jose the past year or so, a few years. So good luck how you work on this issue, and thank you for your time.
Thank you. And our last public speaker will be Scott Largent.
Great. Good afternoon, everyone. Scott Largent. I have personally sat and watched the MCAT team in action out here at the crash zone. It was good to have something else besides law enforcement out here, but I have only seen that team in action now 2 times since it was basically created. Now, it was very interesting to hear Tessa talk about what's going on in her neighborhood. After a lot of these sweeps that happened out at the crash zone, the city has successfully pushed the homeless, the mentally ill into the neighborhoods now. And when you go back behind Bellarmine, and this is not me ratting everybody else out that's trying to survive, but they're up and down the streets over there. There's tents, there's RVs. It's just basically nobody went anywhere. So I'm just wondering, are we going to deploy these teams up and down these streets right now to figure out who really needed adequate care, who didn't get placed into, a tiny home, a safe parking program? A lot of these people have been left in the elements for years. And Chief Garcia at the time told basically the entire department to stand down for close to 9 months out here. I have personally witnessed people going absolutely crazy out here. I've seen people butt naked in traffic, smoking meth, throwing traffic cones. But the MCAT team doesn't seem to show up for things like that. When it's in the middle of heading, I guess it doesn't matter. Same thing over there on Coleman. You watch people literally that are mentally ill getting run over, okay? But these teams don't show up. And the county team, for some reason, it's always a 6 or 7 hour response time to get out. And that's not quick enough to actually help people. So that's just what's going on out here. It's a humanitarian disaster and a mental health disaster. So we could have that team here.
Right, thank you. Come back to members of the committee. Don't see any hands at the moment. I will have a couple questions, so I'll start. And this is in relation to the second part of the presentation on the MCAT team. And first off, thank you for the more detailed and thorough report on this. Was very interested in getting this report back and having a better understanding with this committee and for our community on the MCAT Mobile Crisis Assessment Team and its work. And I think the importance of it and what the realities are for it. So number one, this is obviously from our standpoint, but it is a partnership program requiring county clinicians. And looking at, for instance, the slide where you had on the staffing and operational hours, does that same shift, the 7 days a week, 10 hours a day, 10 to 8, does that overlap with the county clinicians as well? Are they always available when MCAT is available? Oh, and Sergeant, you are muted.
Sorry about that. Thank you for the question, Chairperson Perales. So in regards to the county's clinicians' hours, so yeah, their hours do mirror us. They work from 10 to 8. In regards though to after hours, they are on call. And then on the weekends, they also go to an on-call status. So they don't have staffing like we would. They just go to on-call status on the weekends.
Okay, and have we found it where they've sort of always, for the most part, been available to partner with us then through this pilot?
Absolutely. Every time that we've ever reached out to them to have a call or vice versa, they've always been available for us. We've never had an issue where they have not been available.
Okay, and in regards to the last slide that you had talking about the budget for us, number one, and then I'm curious about on the county's end too. But for us, it looks like current funding is set to expire next month. Is that correct?
So that extension that we received, that was the whole purpose of, there was actually two purposes of why we applied for that extension. One is because for the funding, obviously we wanted to exhaust that funding. So we needed to apply for that extension. And then secondary is because we had some deliverables within that grant that we needed to complete. So we had to apply for that extension. But the funding in itself, more than likely will be dissolved by April, May of 2022.
And that's from that extension Office of the Justice Program, that grant?
Correct. That is correct.
Okay. And then following that, we'd have to identify more funding, right, to keep the program going. Is that correct?
That is correct. So so back in the summer of 2021, we have applied for a grant through other programs, and we're just waiting to hear back whether or not we will receive any funding through those grants.
Okay. But right now, totally contingent on this grant funding, unless we at the council are going to try to implement it within the base budget, and then not be reliant on grants. And that's just info for my colleagues as well. And as we sort of round out the year and understanding for next year's conversation, are you aware on the county's end? Is that a similar model? Are they just using base county budget? Are they going off of grant money as well? If you're aware of that.
So I do know in regards to the county themselves, I do believe that they are actually a funded program, the Mobile Crisis Response Team. They are a funded program in itself. They do not rely on grants. They are funded within their county budgeting. It's entirely different than what we have with the Mobile Crisis Assessment Team.
Okay. Okay. That's it for my questions on MCAT. Again, thank you for the update. I appreciate that. And going back to the redistricting slide, I don't know if this will be for you, Lieutenant Donahue, or maybe you, the chief. Well, good to see you, Chief Mata. So On the redistricting, I know we're still at the very beginning here. One of the things that's happening right now as well is the council redistricting. We'll be making a decision at the council in January, actually a final decision on the new district lines for the council. And I think that will marry well, obviously, with your work that's expected to start for phase 2 in January of 2022. As we have done an analysis now through that to redraw the council district lines. I know that your lines don't completely match up, obviously, with the council lines, but I think right, it's good information to utilize, and just wanted to make sure, Chief, you're aware of that, and whatever vendors, right, that consultants we bring in, that'll be, I think, great information for them to take advantage of as we complete that, and that work won't be done right for another 10 years. So that I think is just happens to be a good coincidence that those two are tied up together.
Thank you, Chair. I agree, given that it's population, that's one of the factors that are utilized in our redistricting. That's definitely information that whoever the vendor is can utilize. Thank you.
Yeah, no, thank you. Okay, that's all my questions. I do see Councilmember Mahan.
Thanks, Chair. Sorry, I had a hard time unmuting myself there. I'll be very brief. I just want to thank staff, congratulate you on the progress with MCAT. I think it's really an exciting program. I think it seems to be delivering the kind of quality of service delivery that we want. And I'm personally very supportive of finding ways to keep the funding going. The only specific question that came to mind as I was listening was whether or not we're learning that there's a category of calls that maybe doesn't need an officer involved at all. Obviously, we're going to always want to have an officer available if things do head in a bad direction. But I know there are some programs, I've looked at Cahoots and others like it around the country, and somewhere that joint delivery model is not the norm in some places. And so obviously there's a point at which you want clearly will want to always have an officer be there present. But are you noticing, are there some calls that feel lower risk, lower order challenges or crises that truly do not need someone there with a gun? And is that something we've talked about with the county at all? Do we have any insights just now that we've had this experience?
Thank you for that question, Councilmember Mahan. So I mean, that's one of the benefits, I think, of being able to go out and kind of have the ability to kind of like specialize in these mental health calls. Yeah, there are definitely these calls for service where you do not need of an individual or a patrol officer to go out. I mean, some of these chronic 911 callers, for example, who are experiencing mental health crisis where they're just in a state of paranoia, where maybe they're off their medications, they're not a threat to society or anyone. They just simply probably need some type of service connections of some sort to where maybe it is someone, as you mentioned, who's not a law enforcement agent or officer. It's just simply maybe a counselor of some sort or a therapist who can go out and outreach to them, a case manager who can get them service connected and get them what it is that they need that realistically a law enforcement officer could not provide them. So yeah, I do think that we do see a lot of those calls that as an MCAT unit right now, we do intercept or we try to the best that we can to kind of like limit the fact that our officers don't have to go out and respond to those calls, because it does give us the opportunity to kind of be that barrier between patrol officers versus having the patrol officers have to respond to those and having MCAT deal with that with our clinicians, so that maybe we don't get that secondary call from those individuals.
Right. Thank you. That makes a lot of sense. And that's sort of what I suspected. But so then I guess that leads to another question, which is just whether or not we have the forum, or to what extent have staff at the city and county levels been able to talk through kind of a unified approach that would maybe beef up some of those other non-law enforcement related responses. And it just seems to me, again, this is anecdotal. I don't have nearly the data or insight that you all do from being out on the ground, but it seems that there is a lot of need out there that is in that category that you just described. It's maybe more chronic, maybe is not pretty clearly not a threat to public safety. And I'm just curious, the state of the conversations, or to what extent we've explored, presumably with either our partners at the county or third party nonprofit providers, beefing up alternative responses and maybe taking more of the load off of our staffing. Is that what's the status of that, if any?
To be completely honest with you, I don't know if that is a conversation. I have never been privy to a conversation of that nature, so I'm not familiar. I'm sure, behavioral health may have. I'm just not familiar if that conversation has ever been discussed.
Okay. Yeah, no problem. And we can explore further offline in the future. It just seems like potentially a fruitful thing for us to look into, especially as we've got to figure out how to fund all the different services we want to provide. So again, I appreciate the update, and congrats again on the success that we've seen. I think it's really promising. Thank you so much.
And excuse me,
Motion to
Chair.
approve.
I will second that, but go ahead, Chief.
Thank you. Yeah, go ahead, Chief.
Sorry about that. I just wanted to give Councilmember Mahan an update. During the reimagining process, there was a presentation by someone talking about what the county is doing right now on alternative responses. So I know they're rolling that out. Perhaps we can contact them, or I don't know if someone here on this call is in contact with them, where they can give a presentation as to how their project is coming along. And I think it's a program where the residents will call a different number other than 911 to receive those type of services.
Great, thanks so much. And Chair, that was all I had. Thank you.
Great, thank you. We have a motion to second now. If we can do a roll call vote.
Arenas,
Yes.
Mahan,
Aye.
Jimenez,
Aye.
Perales.
Yes.
Thank you.
All right, thank you. Motion passes unanimously. We'll now move us to, and thank you everybody for presentation. This moves us to item D2, our police reforms work plan reimagining community safety work status update. And I believe I'm turning this one over to Angel.
Yeah, thank you, Chair Perales and council members. Angel Rios, Deputy City Manager, here with the City of San Jose, joined today by Poncho Guevara, Executive Director of Sacred Heart Community Service, and Peter Hamilton, Assistant to the City Manager. And we're here today to provide an update on the work of the Reimagining Public Safety Community Advisory Committee. I'll give a little bit of background and context, and then turn it over to Poncho, who will give a more detailed update on the committee's work. Just as way of background, based on the proposal from the Community Coalition, the City Council established the Reimagining Committee on June 22nd. It was established as a community-led body that had the scope to make recommendations along these four specific areas. Number one, alternatives to policing. Two, transformation of police policies and practices. The third being increased police accountability and transparency to the public. And the fourth, implementation strategies. The council also provided direction that 6 members of the body must live within the Mayor's Gang Prevention Task Force areas or Project Hope neighborhoods. Members appointed by community organizations could count towards that total, and any additional members needed to reach the total of 6, which would be recruited by staff and seated by the Reimagining Committee. As you know, instead of appointing individuals to the committee, the council did designate a list of community organizations that would appoint seats on the committee. consistent with the coalition's desire that this be a community-led process, and that's what has taken place. That committee is formed. We provided an update to this committee in September on the progress of this effort. A couple of key highlights. The first thing I'll note is that a total of 6 members who live in hotspot areas I just mentioned, or Project Hope neighborhoods, now sit on the committee. 3 of these members were appointed by community organizations. They live within the Washington Alma area, 10th and William Street community neighborhood, and Julian Street neighborhoods. To make up the total of 6 members, staff recruited 3 additional community leaders from hotspot areas and Project Hope neighborhoods. These members have been seated on the commission as well, the committee as well. They represent the Cadillac Winchester, Santee Phelan, and Valley Palm, San Jose apartment neighborhoods. The committee has also organized itself into subcommittees. These include a steering committee that is helping to organize and guide the committee's work, as well as policy committees that are developing recommendations in specific subject areas. For a more detailed update on the committee's work, I'll turn it over to Poncho Guevara, who's a member of the steering committee.
Good afternoon, members of the council. So I just wanted to reiterate, like the process, the Reimagining Public Safety Community Advisory Committee process is really here to engage in community organizations and in other neighborhoods in a meaningful, in setting up and developing a set of meaningful recommendations for reform and alternative policing in our community. And so the conversations that we've been diving into have been really about exploring and understanding the perspective through the lived experience lens of individuals that are impacted by law enforcement and need community resources and other things to try to make sure that they're centered in addressing their concerns. So like some of the questions that you were bringing up, Councilmember Mahan, about the role of community-based organizations and law enforcement and other things really came out in a number of the presentations that we've been making, like exploring what are the ways that we can actually utilize things. So in addition to a presentation by one of our members and some work that have been done by them to organize a community forum, Parents Helping Parents that help convene other organizations like Silicon Valley Independent Living Center and other organizations that work with individuals with disabilities and the people that love them, exploring what's happening in terms of national models around alternatives to addressing the needs of folks in those communities. Similarly, a mental health and crisis response, looking at research and presentations and work that's happening in other communities and different models that exist there, including an update on the mobile community response pilot program that the Race Equity Action Leadership Coalition, the Behavioral Health Contractors Association worked on developing a proposal that the county was able to get funded last year, or actually earlier this year, and we've identified a contractor that's going to be leading that effort, and that will be starting it in pilot, I think 4 pilot zip codes starting in January. So we've been working on that work there, but the presentations have been really focused in on being able to understand what the different models are. Are there different cost-effective and community-centered models that don't have to put law enforcement in the way of having to address every situation, every community crises that comes up in our community, especially around mental health. We've been speaking on that. And the last presentation that we had was a deeper dive into issues of intimate partner violence and domestic violence and how that works, and how are we dealing with issues of sexual-based assault and other things in our community, and what are models that can be done that don't have to involve our traditional way of doing things and involving the carceral systems and law enforcement, but being able to work with and partner with them in different ways. We've also spent time in the committee over the last few months. We were kind of slow rolling on some of the recommendations, or starting to develop different things because we wanted to wait for, like Angel gave an update about. We had a number of members, including members of the Neighborhoods Commission and the additional community representatives from the different neighborhoods over there. We didn't want to be making decisions before those appointees were actually seated, including creating a steering committee and some other things. So we have a full committee now. We're moving very aggressively to actually have with subcommittees that are working on police accountability and reform, alternative safety response, prevention and promotion, And like I said, a steering committee that's helping to plan our agendas and doing things. So we have a number of exciting forums that are coming up over the next few months, looking at the impact of, of these systems on African American community. On I think the next one that's happening December 2nd, I believe, or December 1st or 2nd, is going to be talking about the impact on unhoused communities and their relationship with law enforcement and public safety issues related to that community, and how to center their experiences and voices and perspectives as part of that. And we're taking that information back from these presentations that are being made in these conversations into these subcommittees that are working to develop and prioritize recommendations, and being able to receive additional public forum feedback. So the next slide, I think we talk about the next steps of our process. So subcommittees study and produce draft recommendations. Is happening between now and the end of December. There's also a community process that's happening right now involving the People's Budget, which is the tool that I mentioned at our last update that San Jose State University has developed, that's collecting information about resources and priorities that community members. We have about 3,000, I think, surveys that have been completed to date. We're trying to push that over a little bit more from folks throughout San Jose to actually get some of their feedback on what some of those priorities might be, and feed that into our process, including our ongoing meetings that are happening. And we're looking forward to, between January and January 31st, subcommittees taking the recommendations to their constituency for feedback, to be able to have different community forums and action similar to what the Parents Helping Parents modeled for us as one of the organizations doing this work. And then February, really, we're going to insist that the subcommittees are bringing back the Reimagining Public Safety Community Advisory Committee for input and approval as the time frame. And we would like to finalize approvals and recommendations, hopefully beginning more likely the end of March. So we continue to meet at a pretty robust pace, a couple meetings a month. We've got subcommittees that are working very diligently and trying to make sure that we're centering that kind of community impact and getting the voices involved in the People's Budget survey process and other things to collect that input. So that's the latest on our work, and we really appreciate the work with the administration to help us fill out the committee with the additional appointees that the council wanted. And we'd love to be able to present, if there's information that we want to present in advance of that, we certainly can talk and share some of the information that we've actually been discussing ahead of time. It might be good for us to preview some of the topics and ideas that have formulated that to council members before, instead of just waiting till the very end. We'd love to be able to involve you in that. But our hope is to be able to have recommendations in place in time for your budget process and looking at what needs to happen over the long term. So that's where we're moving on a fairly aggressive time frame. But we understand that some things might take a little bit longer. One last thing to mention, that we have one of our subcommittees working on police accountability had been working hand in hand with the Charter Review Commission members, the subcommittee of the Charter Review Commission, looking at setting up a ongoing structure that could help inform, help provide feedback to future councils around how we are able to provide some public oversight and accountability, and similar to what happened in other communities. So we understand we had to work with the city attorney's office. We couldn't directly submit letters or other things directly to that commission, but we did have members that were involved and available to actually help guide that process and their deliberations. Because I know there were concerns from this committee last time that why are they working on something that you should be working on? We felt that it was nice to partner with them, and so that's the latest on the Reimagining Public Safety Community Advisory Committee.
Thank you, Poncho, and that concludes our presentation.
Okay, thank you. We'll go to members of the public first. I see a couple hands up. First off, we'll go to Tessa Woodmansey, and this again is on the police reforms work plan, reimagining community safety work.
Thank you very much. Yes. Oh, I love a little police reform work plan, reimagine. Yeah. Well, I've been complaining about the fact that it's not really accessible, and it doesn't come up on the main sheet of when I go to city clerk, and I tell everybody that's how you figure out what's going on for the day, and what the meetings are. You go to city clerk, San Jose, and you push that left button that says meetings and agendas, and I don't see it there. And maybe it's changed. I'm not saying it's perfect, but I'm perfect in not knowing it's there, but there's been a problem with it. It's been hidden. And, I even talked to, Peter Hamilton about it, and he was supposed to do something and it got back, get back to me, but I never heard back from him. And so basically, that's a problem, is that it's not accessible to the public as the other meetings are. And it should be on that first list, current meetings coming up, and I don't see it. And then on top of it, the subcommittees, that's all well and good. And it's just like with the Charter Review Commission, is that the subcommittees need to be opened up. And that's how they do it in Berkeley. The subcommittees are open to the public. And I think it's really important that we, get the most bang for the buck, when these meetings are happening and these, resources are being put to make public input part of our decision making, which is so important. And especially, in terms of our climate, we need to get the input from the, the scientists and on top of it, the public. And so we're not doing that in our subcommittees. And so it needs to be opened up, and that's one issue. And I guess that's basically it. The meetings, making that accessible to the people, the subcommittees, and those type of things. So, and I think they're doing a good job overall, trying to get more, caring into our police.
All right, next speaker is Blair Beekman.
Hi, thank you. Blair Beekman here. Tessa and I think we can work. We've been working together very well. That I think we can help address issues of openness issues for the future of committees and subcommittee processes. There's two really important committees coming up: the Equity Roundtable and the COVID-19 Economic Forum. They may need some subcommittee help. That things were a little bit closed after the May shootings of the VTA. We kind of got a little closed up, and so the current Reimagine committee and their subcommittee process has started a process that may be a little bit closed for their study session purposes, which is respectful, and I want to respect that. But I hope we can work with them to consider the ideas of what really can be a good openness and accessibility for the entire community to better understand the process. I think that, as Tessa was saying, it's a more interesting way to work. The study session ideas can be helpful, but it's something we can just talk about and hopefully help better develop for the upcoming committee meetings, commission meetings. To quickly offer the task force ideas, or not task force ideas, there's police peer review programs from the last item that I think possibly can be of help. Their ideas are really to consider Reimagine, maybe a little bit too broad for this group, but an important concept to mention at this time. And with 25 seconds, boy, I really think there can be ideas we can extend the future of the charter process by considering there has to be possibly legal language issues that have to be worked on. Now that could be the main focus. And then while working on those things, possibly they can, ask some questions with the Reimagine Task Force process, and that can go through the early springtime. Thank you.
All right, thank you. Our last public speaker will be Scott Largent.
Thank you, everyone. Scott Largent. The gentleman from Sacred Heart, I believe his name is Poncho, brought up in one of his items there was the relationship with the unhoused community and law enforcement, pretty much the San Jose Police Department. That is a sore subject for me right now, watching how the homeless are currently being treated by law enforcement, and especially out here at the crash zone right now. You guys are utilizing a lot of secondary employment officers during sweeps, and they are not following the duty manual. They are not following their basically their processes, their procedures, notifying a supervisor, notifying a captain, and going through that chain of command. They are basically going back to the city attorney's office, the housing department, and they're not bringing out the proper people that the community is asking for. And then they also like to default to contacting home first, and I like to call them home last, because they're doing absolutely nothing for anybody out here. The homeless community is burned. Just like myself, 5.5 years ago, I got burned bad by the city of San Jose, the San Jose Police Department. You guys have heard me talk over and over again for years about my motorhome. I've met hundreds of people that have had their motorhomes taken, okay, that were not allowed to access their property. And Chief Mata, I still legally own that motorhome. Do you find that weird? Those voicemails that I've been leaving you, asking for you to yank the permit from Courtesy and Motto's Tow, would be the right thing to do. You have the power to do that. They stole my motorhome, and they're committing aggravated perjury right now on the record in our superior courts. And I think you need to do the right thing. Do the homeless community a solid and put these tow companies out of business.
Okay, we'll come back to members of the committee. Don't see any hands up. I will just start with saying thank you for the update, Angel and Poncho. It obviously sounds like we are on a better path than we were before. And I think not hearing any concerns or complaints from our community, or more importantly, members of the task force, or I think that's what we were hoping for here, and it sounds like things are on track. And I would just say the slides and what Poncho showed on their work, Angel talked about kind of how their process will end, and then having something to bring forward. It didn't mention on what that looks like on our end, and so if you can let me know your thoughts, Angel, on once they're done with their recommendations, do you believe they should be coming back to this committee? Poncho did mention, maybe a dialogue of sorts right ahead of time to talk a little bit about through that. So what is your thought, Angel, on the next steps after they're getting closer to being done, or once they are done with their recommendations?
Yeah, Chair, I think that's a great question, because as you heard today, I think the committees are getting to kind of the root of a lot of the issues and are preparing recommendations. And so right now, based on council direction, they're set to come back directly to the council. It may not be a bad idea for them to come back through PISFIS and then cross-reference their recommendations to the full council. I think just given kind of the scope of this subcommittee, that makes a lot of sense. We're definitely amenable to that. If that works for the community coalition, that works. Right now, the key role that we are playing, we the city are playing, is really one of strategic support and providing the support that they need in order to support the work that they're doing by way of either access to consultancy resources, assistance in terms of Brown Act compliance, and in connecting individuals to city-related data, right? But what perhaps we could do is go back and discuss that with the steering committee, and if they see some value in maybe bringing that to PISFIS, maybe we could adjust that recommendation and do that accordingly. Poncho, I don't know if you have any thoughts on this.
I also understand, Poncho, obviously you were saying the timing here is trying to get in front of council for particular budget actions. So, I don't think we need to put any constraints. I would just say if there is that flexibility and timing, and if there is something that you were thinking, Poncho, that, hey, would be worthwhile coming back through committee, that we can keep that door open. If you give me or Angel a heads up, then we can try to add that to an agenda. Otherwise, if it looks like now you're really just pushing up against the time here, and you want to just stick to coming to council, I'm fine with that as well. So I just wanted to and you can feel free to respond.
Yeah, I think it would be, I think it might make a lot of sense to be able to give some kind of update to council, or update to PISFIS, in advance of the council conversation. But I think we'll probably end up, requesting, a study session of council, which will be a little bit more, in depth and a lot of different voices. And so being able to kind of coordinate that twice might be hard, but it's certainly a couple members of the steering committee being able to come and address this committee and kind of give you all kind of a heads up on that. And I think our goal is not just to, wrap up a report, give it to you, and, peace out, but to be in a position where we're able to kind of work with you all in terms of over the long haul, and helping to make some of these recommendations really come to light. And there are lots of perspectives and lots of things that are coming, but But like I said, there's a lot of great work that this community has already done, and there's a lot of great examples around other communities have done that we want to make sure happen, and if it happens in this budget cycle or it continues to work forward, we want to partner with you on that. And we understand PISPAS is the key driver for exploring the operationalizing of these new concepts in our community.
Okay, sounds good. Thank you. Don't have any other questions. I don't see any of my colleagues with their, oh, now I do. Councilmember Arenas.
Thank you. I snuck in there. Thank you so much for the presentation. I was trying to follow as best as I could. And I'm hoping that maybe you could submit the presentation to us ahead of time, and that way I can come up with my questions also ahead of time. And thank you. I know that you're not part of our staff. You're not getting paid for any of this, but just so our conversations can progress and we can be supportive to you, I think it would be a great idea to have the presentation ahead of time as you're able to provide it to us. One of the items that you talked about was the survey that I think the San Jose State students were helping out with. Is that right, Poncho? Is that a citywide survey? Can you talk a little bit more about that?
Sure. There's the Human Rights Institute at San Jose State University is actually has been doing research, for the last getting back to last fall, to actually look at different ways that communities that have actually engaged in really robust reimagining processes have been able to focus in on their efforts to actually examine where are our current priorities. So it's a participatory budgeting process called the People's Budget that has been utilized in communities like Chicago and Los Angeles. The Black Lives Matter movement in particular has been had utilized this to actually create some of the intellectual framework around which, looking at different resources and things that can make our communities safer and partnering with different organizations could actually happen. And so in Los Angeles, for example, about 50 organizations help get, tens of thousands of people to respond to a survey that help provide some of the tools and resources that help guide their council in making certain kinds of decisions about investments on things like better investments in terms of mental health care and resources designed for dealing with homelessness and other types of issues. So we've adopted that structure here in San Jose. And we've got a coalition of organizations that have been doing outreach to actually get people to fill out a very simple, like about 10-minute, online survey form. We actually did a group of focus groups back last fall and early this year. And a recent report was issued about, what the findings came out of that report. But so far, like I said, we have a few thousand people that responded to it. It's in 7 languages currently. And they're doing the analysis on it right now.
Wow, that is absolutely wonderful. One of the things that we have found in the city of San Jose, and maybe in other organizations this is also true, but the surveys that sometimes are done online, and I think this is primarily that way, right? It's not over the phone, it's mainly online. Systematically leave out some of the folks who may not be as resourceful to, either have an online service or to maneuver through an online platform. And so I wonder how will you ensure that you capture a good, I'm sure the Human Rights Institute has done this before, how will they capture some of the folks who typically online surveys leave out?
That's a really good question. It's actually one of the reasons that many of the grassroots organizations that are involved in the reimagining process are actually the ones helping to administer and reaching out to folks to deliver that survey. So reaching out to communities that are typically low income, concentrations on communities of color, immigrant communities, that's who we're actually specifically reaching out to. In addition to, like I said, we've been doing focus groups and other things to be able to capture some of that information. So our target is not just to broadcast this on, broadcast something on the internet or put it on a website and say, people fill us out. It's been actually talking to people on the ground. So we, like, for example, at Sacred Heart Community Service, we've done over 1,000 surveys, and we've been actually talking to people that are coming to us for
Nice.
services and a range of different resources and making sure that we're able to get that. And other organizations are following suit.
Wonderful, wonderful. Well, I'd like to include some of our neighborhood associations, if you would. They've done the really great job of organizing themselves in some of the neighborhoods that have a tougher time. So it would be wonderful to give you some of that information if that's appropriate.
That'd be fantastic. Thank you, Councilmember.
Wonderful. The next item that I had a question about was the domestic violence. You talked about how you're beginning to incorporate that. Would you say that when you phrased it as domestic violence, do you also mean sexual assault? Is it larger? Is it gender-based violence, if you will?
Yeah, that was a presentation that was led by Esther Perales-Diekman and Darcy Green, who led the presentation that was developed in part through consultation with different members from next door that have been impacted by the system. So it wasn't just looking at intimate partner violence, but it was actually looking at sexual-based or gender-based violence and looking at some of the trends that we have here, not only in our community, but other examples that have happened in other communities. And so they presented that information, and that's feeding back into various subcommittees to look at not only issues around, like, again, there are 3 ad hoc committees. They're not technically subcommittees, but they're ad hoc committees of the Reimagining Public Safety Community Advisory Committee. So some of the recommendations that are coming out are looking at what can we do to make our communities safer in the first place. So there's less of a need for this. There's looking at how do we deal with, are there alternatives to actually having a law enforcement intervention like Councilmember Mahan was referencing? Are there things that we could be able to do that don't have to involve law enforcement to deal with certain kinds of situations? And then third, if there are types of situations that can happen that are unfortunate involving law enforcement and difficulties in terms of that relationship with people, how are there ways in which we can have greater forms of training and accountability for law enforcement's actions that can result in negative consequences towards folks that are in a intimate partner violence or a gender-based violence situation? Are there different ways that we could be able to deal with that? So each of those committees are taking some of those things and helping to formulate what they think the recommendation should be ultimately over the long term.
I think the work may be parallel if we don't intentionally cross our wires and inform your group and your participants in some of the really good work that has already been done, not just by our police department, which they certainly have, but this is an effort that is jointly done with our county counterparts, and a lot of those service providers are part of that network. And so I would love for them to see what we're doing and what our police department is doing, and then be able to check off some of these things, because they might ask for some things that already are part of their work plan, and maybe some of them are even close to getting finished or done, or we're already implementing, like you heard earlier, if you were around for that conversation, the intersectionality tool, and we're doing it it's kind of a 3-prong. We're making sure that our police officers always ask additional questions, whether it's a case about intimate partner violence or human trafficking or sexual assault. The goal here is for our police officers to ask additional questions. So, and to identify the additional issues that impact that survivor and that family. So I'd love to share that with you. We'll connect offline. And so I'm glad to hear that you're thinking that this is your hope, that you're saying that this is gender-based violence and not specific to domestic violence. I know that Esther that's her niche, and she does it very well. I wonder if maybe there's somebody like Community Solutions that provides a different aspect to gender-based violence, and predominantly the numbers that we see here on a bi-monthly basis are for children under the age of 13, and then secondly, children under the age of 18. And so those aren't necessarily intimate partners violence. It's not a domestic violence. people traditionally see that as. And so I don't want that population to get lost because there's a huge pattern and trend around that population. So would you be able to include somebody that represents that segment, like, any other of the YWCA or Community Solutions?
Absolutely. No, we'd be very happy to. And we have other, the part of the good news is that we actually have many other folks in the coalition. We didn't want to bring every organization under the sun to have representation on this. We had, it was hard for us to cull our list down to 27 representatives.
Yeah, that would be a hard conversation, right?
But we also know there's very active conversations at the DV Advocacy Consortium. So the DVAC, which is there, and also organizations like YW and Community Solutions are also very, very active in the Race Equity Action Leadership Coalition, where we're having these conversations as well. But thank you for that reminder, and we'll make sure that we filter back with them when it comes to the recommendation time. I think one thing I just want to respond to, in addition to it, we're not just doing this work and having these presentations and having subcommittees in a closed circuit. We're also, like I mentioned in the in our timeline work plan, is that we are going to be bringing these back to all of our constituencies, not just the organizations there, and trying to make sure that we will have a combination of both public hearings and forums. We're getting that feedback, but also organizations organizing their own workshops or forums or other things to make sure that we're talking to people that have been impacted by some of these systems like human trafficking and other things, to make sure that we're getting their input as well.
Thank you. Lastly, I just want to say, I know that it would be wonderful to see how your process is laid out in comparison to what the process of the council and taken into consideration, the mid-year budget, priority setting, of course, our budget conversations, our ARPA conversations, because it would, I think it needs to be timed correctly so that we can take advantage and benefit from all the work that your group and the folks who are with you doing this work, and so that it gets woven in as we are moving forward, and not wait until the very end to say this is what we have, and maybe some decisions have already been made. And so anyways, I'm not sure how you will do that, but I think a strategic plan that has an overlay from what the process that you're using and the process that the council uses, so that way we can find opportunities to support what you're doing.
No, thank you. I think it's something that both Angel and Peter have actually brought up in terms of like, how do we make sure that we get these things to sync up, and that's going to be part of the focus of identifying some consulting support to make sure that we're able to make sure these things are able to line up. But we don't want any surprises at the last minute for anyone.
But well, you have great people helping you and supporting you. Peter and Angel are just fabulous. So thank you. That's it, Chair.
Thank you. And can I ask for a motion?
Motion to approve.
Second.
Motion in a second. I don't see any other hands. So if we can get a roll call vote, please.
Arenas,
Yes.
Mahan,
Aye.
Jimenez,
Aye.
Morales.
Yes.
Thank you.
All right. Thank you. Motion passes unanimously. Appreciate the update. Now that takes us to item D3. This is our Domestic Violence Prevention and Awareness Annual Report. And I believe turning this one over to you, Chief.
Chair Perales, this is Lieutenant Rob Lang.
There you are. Sorry.
Yep, that's all right.
All right, Lieutenant Lang, take it away.
Thank you very much. I appreciate it. I appreciate the opportunity to be here today. My name is Rob Lang. I'm a lieutenant with the San Jose Police Department's Family Violence Unit. So today we're going to talk about the Domestic Violence Prevention and Awareness Annual Report. With me today, I have a couple of partners from the YWCA. So at this point, I'll ask Lindsay if she could please introduce herself to the group.
Yeah, good afternoon, council members. This is Lindsay Mansfield with YWCA. I'm the Director of Support Services.
Hello, everyone. My name is Cynthia Minchot. I'm also with the YWCA, and I'm the Community Support Manager.
Perfect. Thank you both for introducing yourself. At this point, I'll share my screen. If I can, there we go. Okay. And then we'll go through the presentation. Before I even get started on the slideshow, though, I want to just say what amazing partners Lindsay and Cynthia are. I've been doing the shop for a couple years now, and the support that we have and the leadership they provide over at the YWCA is just amazing. So thank you both for your support, and thank you for being here today. As I mentioned, this is the annual report for domestic violence prevention and awareness. As we get into slide 2 here, this slide breaks down our family violence unit. The family violence unit is housed offsite away from the traditional police department. It's at a facility we call the Family Violence Center over on the Alameda. And our goal is to have the multidisciplinary approach over here at an offsite facility, so it feels a little more safe and friendly for our survivors. There's sworn staff and our partner agencies here in the building. As far as the sworn staff goes, we're broken down into 3 teams. The first team is the domestic violence or IPV detail. Next is threat management, and they would do things like restraining order violations, stalking, threat, workplace violence, etc. And lastly, we have the child, elder, and dependent adult abuse details. Our partner staff here in our building is first is the DFCS, or Department of Family and Child Services. That's Antonio Padilla, who works here in our building with us. Next is our victim advocate from YWCA, and that's Adriana, and I'll talk more about her in a little bit. And lastly, we have our Santa Clara County District Attorney's Office. We work very closely with all 3 of those agencies, and it's awesome just to have us all here together to be able to work on these cases together, with the ultimate goal, of course, of providing support for our survivors as well as successfully prosecuting the offenders. So we get into slide 3 here. This one specifically mentions that YWCA partnership that we have. We have a formal partnership through an MOU and through a contract with them. This has been ongoing since 2016. The YWCA has been our partner for this. Adriana is the advocate that I mentioned a moment ago. She works full-time here in our office. She's bilingual in Spanish, and she does a whole bunch of work for us. She's just amazing. Last year and the fiscal year, any statistics that I give today are fiscal year unless I mention otherwise, but in that fiscal year that ended in June, she had done 1,200 or more follow-ups, and that ultimately resulted in at least 324 referrals to the survivors. And that's just what she alone does. This isn't what the Y outside of our office does, and we all know that they do amazing things there as well. The other half of the contract that we have, part of it, as I mentioned, is Adriana working here in the office with us. And the next part is our 24-hour hotline. So when officers or survivors need to contact somebody, they have that 24-hour number that's staffed and has advocates ready to assist. So that's what the contract does. And that's one of the reasons that we just have such a wonderful partnership with the Y. Slide number 4 here talks about domestic violence occurrences. Again, this is fiscal year 2020 through 2021. And you can see it breaks it down, this chart breaks it down by month. As you look at the left, that column there breaks it down into the 4 main categories of IPV or domestic violence that we would normally see here in our office. And I want to talk about each one of those just to make sure we understand what these numbers mean. The top one is the domestic battery, or 243E1 of the Penal Code. An example of that, just to kind of make sure we're all on the same page, would be if officers are dispatched out on a family disturbance call at a house or apartment or what have you, and they go there and they make contact. The couple is in a romantic relationship, they live together, they have a child together, or something that would qualify them as one of our IPV type relationships. In this circumstance under 243E1, that would be a situation where there may have been physical contact, but there's no complaint of pain and no visible injury. So this is not an automatic arrest situation based on the penal code. It could be a private person's arrest, or there could be an arrest made if the officers see something different, but it's not an automatic arrest. As you can see, for the fiscal year, we had 785 of those. The next category is the traditional section that law enforcement thinks of for domestic violence, 273.5A of the Penal Code. This row here that we're looking at, though, is minor injuries. So that would be a minor complaint of pain, a minor visible injury, or something of that nature. And as you can see, for the fiscal year, we had 1,614 of those. The next category is the most alarming category. That's the one we worry most about, and that's serious bodily injury or a weapon was involved. And that's, again, section 273.5A of the Penal Code, but we break them down so we have an understanding of how many of the more serious offenses are being reported to us. And that number is 451 for the fiscal year. The bottom one is violation of a restraining order, which is 273.6 of the Penal Code. And as you look at that, that's 1,507 of those incidents. If you total that up on the bottom right corner there, you'll see 4,357. I'm going to go to the next slide, and we're going to use that same number, 4,357, on the next slide, and kind of break it down as we compare it to the previous year. So when we look at that top category, in the prior fiscal year, we had 790. In the fiscal year that just closed, we had 785. So very similar numbers. It's a 0.6 reduction. So slightly moved in the right direction, but it's only by 0.6. The minor injury 273.5As went from 1,707 to 1,614. So that's a 5.4 reduction in those reports, which of course is moving the direction we would love it to go. The next one, however, is 273.5A of the Penal Code that has serious bodily injury or a weapon was involved. And that number went from 433 to 451, which represents a 4.2% increase. The next one is 273.6. That's a violation of the restraining orders. That went from 1,439 to 1,507, which represents a 4.7% increase. When you look at the bottom row there, it's 4,369 versus 4,357, which represents a very, very minimal decrease of 0.3%. So overall, when you look at the two fiscal years and compare them, the numbers are pretty similar, but we do notice that the 273.5 with SBI or with a weapon was the number that did jump up 4.2%. Next slide is our domestic violence high-risk response team. As many of you might remember, this is a program that we launched back in 2019. The council was able to provide some one-time funds for us, so we've since found funding to continue this program. We ended up, the Y was able to hire some advocates, train the advocates. We got started. We had 7 in-person deployments prior to COVID-19 kicking off and the shelter in place and everything happening. So at that point, we had to pivot. The YWCA looked and tried to figure out how we can help these survivors who need us the most. And they decided to use what they called a virtual response. And within that, the emphasis was mostly on safety planning, temporary housing, food provisions, et cetera. And so that's what they did. And they provided a lot of help during that. Recently, in-person responses have been able to resume because the threat from COVID, while not gone, of course, has diminished enough to where it makes sense for us to try to get the advocates out there and help these survivors in person. In order to evaluate this program, it was a pilot program, now it's kind of ongoing, but we had an outside agency called the Arboreta Group, and they were hired to conduct this impartial evaluation of our program. They have sent us a couple of drafts of it. The report isn't done. We're hoping to have it early next week to have the final copy. But in looking at the draft, that's going to give us some ideas of some things that we've done well during the program, and also give us some ideas that we can do possibly better into the future. Really, they kind of, the big gist of the report as I read it was to just kind of expand it, try to get advocates available 24/7, try to make sure we expand it. Maybe we could even get some other agencies, not just us in the YWCA, to respond to those high lethality situations. So those are obviously things that we knew we were going to try to do in the future. And we're at the point now after this evaluation where Lindsay, myself, and Cynthia are going to sit down and have these conversations and try to figure out how best to move forward. Next slide is the intersectionality between domestic violence, or IPV, sexual assault, and human trafficking. This was already mentioned a couple times today. So I don't want to beat a dead horse. I will talk a little bit about it though. Briefly, our intersectionality tool went live in January 2020. It started out as, and currently today it is, but very near future it will change. But right now on a DV call or IPV call, we will ask about unreported sexual assault or human trafficking. We don't ask the other directions though. The form is set up a certain way. To our best numbers that we have so far is that for the fiscal year that we are talking about here, 20 to 21, we identified approximately 88 potential sexual assault cases that were able to be investigated that may not have otherwise been reported. In addition, we identified approximately 30 cases that may involve human trafficking and that our special victims unit is able to look into. So I don't know how many of those cases are going to result in a conviction, but that's over 100 cases right there that most likely would not have been reported prior to this intersectionality tool going live. And that's a lot of survivors that we're able to get assistance to. So overall, I would consider the program a success. Now, where do we want the program to go? We want the program to go all three directions. As I mentioned, right now on a DV call, we ask about sexual assault or human trafficking. Moving forward, and I know Lieutenant Donahue spoke to this earlier, the form is at the printer. As soon as that form comes back from the printer, we're ready to hit go on this. So whether the officer is investigating a domestic violence call, a sexual assault call, or a human trafficking call, no matter which one of those they go out on, they will ask questions, of course, to investigate the one that they're on, but they will also ask questions to figure out if either of the other two have taken place. So we expect that that's going to help identify additional cases of domestic violence or human trafficking. So I think that that's going to be a step in the right direction and help us identify more survivors and help us get them more help. Okay, that's number 7. Oops, excuse me, slide number 8, Office of the City Auditor. In March of 2021, the City Auditor for San Jose wrote a report entitled Advocate Referrals, Further Improvements to Processes and Data Sharing Can Help Connect More Survivors to Services. It was a very thorough report. They did a really good job. They gave us 6 overarching recommendations. Some of those had a couple of sub points, and some were just a direct recommendation. Our department looked at that. We agreed to all 6 recommendations, and from that point forward, we started to implement them. Some of these changes are not very simple to implement, so some of them do take time. We're trying to make sure that we do them and get them right. As of right now, all 6 of them recommendations are very near, or if not completely done, they're very close. One example would be the domestic violence resource cards. Myself, Lindsay and Cynthia from the Y, the district attorney's office, and a bunch of other entities within the county got together and we looked at the DV cards and how we could make them better. We went back and forth. We had numerous iterations of that card to make sure that we got it right. Those 2 are at the printer right now. So these are the kinds of things that have taken quite a while to happen, but we think that it was worth doing right. And I think that we're very close to making those cards a reality. They're not only going to be fully translated from English into Spanish and Vietnamese, which was the initial request, but we're also going to have them in Cantonese as well, because that's the fastest growing language in our area. So a lot of positive things. The bottom half of the slide here, I break down some of the DV related portions. There were numerous duty manual sections that were updated. I know Lieutenant Donahue spoke earlier about some of the changes that went into effect for the sexual assault unit. Many of those were also duty manual sections related to family violence unit type sections, the domestic violence, child abuse, that kind of thing. And we definitely make sure to incorporate the trauma-informed portion of that. We've been doing that as a department, but we formalized it and made sure that that was in there. Evaluate the high-risk response team. I already mentioned that. That report should be due hopefully early next week. Information sharing with the YWCA. I think Lindsay and I already had a really good relationship the last couple of years where we shared information, and anything that either one of us needed, we would just simply request it and provide it for the other right away. So I think that that's good. And then lastly, our crime prevention unit we're working with them and other entities as well to target communities disproportionately affected by domestic violence, sexual assault, human trafficking, etc. So a lot of things going on. I know my partner Jaime Jimenez over in our sexual assault unit And I know my partner, Roger Seymour, over in our special victims unit, they've been working out a bunch of things as well for these 6 recommendations. And that report, I'm sure, will be coming out. We're going to formalize that in a report, all 3 of the units together, as well as anything else that was done within the department, and put that out to report back to the auditors, as well as I assume we would report that out to this entity. All right, slide number 9. Talking about the resources that we have. The staffing of the family violence unit, I think this is important to note. We're authorized for 20 sworn staff within our unit. We currently have 14 full duty staff, but we also have 2 additional modified duty staff who they do work full time. They're just considered modified duty right now. So we have 16. Last year at this time when I gave this report, we had 14 in the unit. So those 2 extra detectives assist a lot around here. Those 2 extra bodies help a lot. I know, like every other agency in the department, we all want bodies. I know that our command staff does a great job of looking at which vacancies are prioritized, and I know that everybody up through the chief places a lot of importance upon sexual assault, intimate partner violence, special victims unit. These get a lot of attention, and I know that we're trying to get more detectives over here as staffing permits. The domestic violence team specifically, for the stats that I mentioned earlier today in this presentation, we have 1 sergeant, we have 5 full duty officers, and both of the modified duty officers on that team. So a total of 8 that are pretty much dedicated to domestic violence, and they do a lot of great work. Last thing I'll mention here is our crime prevention unit. They've always done a good job of going out and working with the community. It was a little challenging during the COVID shelter-in-place times. They've always had healthy relationships presentations. They've had things to prevent violence in teens, presentations they did at high school, that sort of thing. And then, of course, like I said, during COVID, it was really difficult, but now they're back to doing some remote presentations and some in-person presentations. And they do a great job over there with our crime prevention unit. So at that point, that kind of concludes what I was going to speak about. I think at this point, I'd like to turn it over to Lindsay and Cynthia if they have anything they'd like to add.
Thank you, Rob. We did want to add, and Lindsay, please feel free to jump in. We wanted to add a little bit about the funding. If you want to kick us off, Lindsay.
Yeah, I think in terms of funding, this is a challenge that we're seeing across the board, right? Not just for services like ours, but I think every council meeting that I attend, there's programming that is really important and vital to our community, and we are lacking funding. We recently learned that we did not get, well, not us, but City of San Jose, SJPD did not get funding for our sexual assault investigative unit advocate and our court advocate renewed. So these are services that we have figured out, how to maintain our advocate within the SAIU unit for the time being. But this is a critical service that's in jeopardy at this point. And the court advocate, as you can imagine, is something that comes up quite a bit, and it's a high need in the community, and we are under-resourced there. So we value this partnership. I think we're committed to this partnership from all the way around. And it's just determining how we continue providing the level of service as we keep getting funding hits all over the place.
And then I'll just add a little bit more around, since I'm the one who supervises the advocate who is under the SAIU funding. Having a co-located advocate has been tremendously beneficial because the advocate serves as a contact for the SAIU department and YWCA advocates. The advocate has been able to build meaningful relationships with SAIU detectives, which has really allowed detectives to better understand YWCA services and offer those services to survivors. In turn, advocates have better understanding of the criminal justice system and are able to explain the criminal justice avenue more thoroughly. Anytime a survivor has a question about their investigation, we can easily reach out to the embedded SAIU advocate who has built these relationships with detectives. We're also able to connect more survivors to advocates. For fiscal year 2019 to 2020, we saw 89 referrals to YWCA, while fiscal year 2020 to 2021, we saw 315 referrals, making that an increase of referrals of 253%. There's also more cohesiveness, planning, and scheduling with the SIU department. The co-located advocate has helped with the coordination and presence of advocates at the Children's Advocacy Center. The advocate has helped ensure that survivors always have an advocate present, and when our in-person advocate has been dispatched to another response, the SIU advocate has been able to step in to cover those gaps. Having a co-located advocate attend SIU's monthly meetings and being there a couple of days a week has resulted in trust and clear communication. The advocate has been able to inform and provide feedback to SIU standard operating procedures to ensure optimal collaboration between our two agencies when serving survivors. Since our partnership, we've also been able to identify gaps where before perhaps detectives were not calling our support line and are now calling, asking for specific resources for survivors like shelter, safety planning, or an in-person advocate for a detective interview or MDI. Overall, the SIU advocate has been extremely valuable in building relationships and improving services for survivors, and we hope that that can continue with additional funding.
And one of the reasons that we speak to that is, we're talking about the intersection screening tool and how much overlap there really is between sexual assault, domestic violence, human trafficking in our community. And, to have equivalent services to all populations is really important to us.
All right, thank you very much. Is that it, Lieutenant Lang?
Yes, sir. Thank you.
Thank you. Okay, we will go to our members of the public first. And first up, we have Tessa Woodmansey. And just as a reminder, as denoted on the screen there, this is on item D3, the Domestic Violence Prevention and Awareness Annual Report.
Thank you so much for saying that, to helping that disabled people, that they can hear it and everything. So thank you, Raul. Great job. Okay, good. So basically, domestic violence prevention and awareness annual report. Well, the issue, and they talk about human trafficking. And whenever I see, I live on Stockton Avenue and it's near Bellarmine High School, and the Bellarmine youth are going to the train station at the Diridon, and they walk in front of my house. And now we have planned a hotel in front of, is what's planned. The city is planning. And like Paul Soto has said about his youth, how he was having to live around, movie theaters that were sex theaters and X-rated theaters, and having all that sexual contact with these people who are in the neighborhood, and blaming it on our community. And it's the way we build our neighborhoods, and this is the problem. We don't need hotels in our neighborhood, and that the hotels bring that kind of anonymity, and this is what breeds the human trafficking and sex trafficking and things like that. And we shouldn't have that in our neighborhoods. And this is important. And then on top of it, in terms of how we build strong, resilient communities. And I was thinking, I always say, we have to go towards self-sufficiency, growing our own food, canning our own food, things like that, that's where all the waste has come in, as we're not doing those things. And it's really building strong communities. And that's where you have to work on that. That has to be our, it's not self-sufficiency, it's community. We need to work together as a community. But actually the term self-sufficiency is where you have the man with the gun and the canned food. It's the community working together to build our community.
Thank you. And our last public speaker will be Blair Beekman.
Hi, thank you. Blair Beekman here. Nice words from Tessa on that item. A new thought process she had with that item. It was nice to hear. Thank you. For myself, I guess first, I was perhaps, it would be a bit more appropriate to ask and talk about police peer review programs on this item. I mentioned it on the previous item as kind of just a awareness of ways that we could be considering the ideas of Reimagine. I know they don't really want to work on those terms, but that will be coming around them at some point soon, and just for them to be aware of it, that's one step. Now, to bring it back to this item, I hope the police peer review program can get a bit more, looking into and worked on by, yourselves and at the county level. These sort of items are being talked about, a lot at the county level, and I've been in on the public conversations and public meetings with the supervisors. Supervisor Chavez is interested in the peer review program. Supervisor Ellenberg, she's been asking about, how's the mental health, emergency unit, kind of that roving unit going around. It started as a really interesting idea. How is that process going? And can that help contribute to these domestic violence issues? And so I thought I would just mention these things at this time, and as a couple choices in how to move forward and how we work to better address these issues. And it is a community effort. And I thank you. It was heartening to hear that people are learning how to report things more. Now it's learning how to ask people to stop harassing people. So thank you.
All right, thank you. Back to our committee, and see Councilmember Arenas.
Thank you, Chair. And thank you for the report. I wanted to ask about how you all interact, if at all, with the housing and childcare subgroup that was created out of the joint meetings with the county. And the reason I asked this is because there's some insights that you are all acquiring as you're moving through serving gender-based violence survivors. And I think you said there was a couple of items, resources that predominantly folks ask for, one of which is housing. So is there any thoughts about maybe somehow interacting with this subgroup? And this subgroup is new, and I'm not asking for additional work. I just think that you can help inform some of these folks who are making decisions about housing. Jackie's, this is our next item on our agenda. And although there's providers all around the table in those subgroups, I think it would be a really great way to enhance what they the work that they are doing.
Yeah, thank you for the question. So me personally, I haven't interacted with that group. I know there are people from our department that do that. On our unit here, that hasn't been something that I've been involved in. I know that, like I said, I know that is being looked into. I know we do have people working on it, and I get information from some of those people, but I haven't personally been involved.
Yeah, there needs to be a way to somehow connect both of these things, because Jackie from our housing department, our housing director, was able to fund like childcare last year through some CDBG funds. She was able to fund some very specific gender-based violence, housing for gender-based violence survivors and of sexual assault. And so I think some of the folks that you're serving are the same folks that they're thinking about and planning for. So somehow maybe we can just take this offline, or as you hear the next presentation, you'll see for yourself how you fit into, or how you could potentially fit into that. Okay, so I heard loud and clear that the human trafficking numbers were up, and I know that you're not sure which ones will, if those will see a court in the end. But could you share a little bit about the profile of, and I hate to use that word profile, but I'm wondering where we're finding the human trafficking victims. Are these folks like maybe now that some of the massage parlors are closing and we're finding more of those brothels in residences? Is this part of that work? Where is that coming from?
Yes, so the intersectionality tool, when it does identify potential human trafficking, when it does get identified, it goes right over to our special victims unit. So Lieutenant Seymour and his team would look into it on that one. So he would be the expert that could talk to that.
Oh, I see. Okay. And he's not here. Correct. Okay. All right. Well, we'll take that offline. I was just curious to see that number. I also look forward to seeing that additional feature on the intersectionality tool. I know that it's being, from the conversation with that we had just a little earlier in this meeting, that is effective, and so I'm looking forward to seeing how it will impact our sexual assault survivors and learning about what's impacting them. The last thing that I wanted to, you answered a lot of my questions in our debrief. So the only questions that I have now are about resources. At the end of the year, which is where we are right now, we know that burglaries typically go up. There are certain neighborhoods, I know in my district, I know these neighborhoods are always going to get hit, and now people are very sophisticated. They'll do packages, which is so easy to do versus breaking into a home. But is burglary just the same, right? And so if that was happening, I know that our police department, because this was done and is done throughout all of our districts, will get the resources together and we address the issue. These crimes that are gender-based violence are increasing. We're seeing the increase, and whether it's a slight increase or a significant increase, this is the type of crime that takes a lot of resources and support. What is the reason why we're not able to go up to 20? I think at this point right now, I heard it was from the presentation, it was 14. And there's vacancy and opportunity to fill those up to 20.
Chief Washburn, did you want to address that?
Yeah, sure. I'll jump in there, and then certainly the chief could always chime in after. So in the Bureau of Investigations, we have authorized staffing. Certainly, we're not at capacity. We do have a fluctuating vacancy rate of those authorized positions. And the reason for that is just, if you look at the core services of the San Jose Police Department, certainly to thoroughly investigate, right, and successfully prosecute, we need detectives to do their job. And in addition, we also have core services from the Patrol Division, which is part of the Bureau of Field Operations. And what happens is, as our officers come in and they get trained, right, obviously that number fluctuates. You and council have those conversations all the time. We're grateful to have the Hire Ahead program and all these things, right, the authorized staffing that we have as a whole, as a department, right, affects the Bureau of Investigations. And we in the Bureau rely on the overall bandwidth and capacity of the police department to be able to allow somebody to leave the Bureau of Field Operations and come over here. So just as a case in point, you might have a patrol officer, gets hired, he or she does their 3 years, they apply for a unit, and eventually they come over. In investigations, we have to wait for operations to release that body to come over here. And, we all sit at the same table. We have conversations weekly about needs. It's my responsibility to work with the chief officers on getting those bodies over here. They hear me all the time talking about my vacancy rate. And we're constantly, reevaluating and negotiating those numbers so I can bring us up to our authorized staffing here. And so, it just really all boils down to our overall numbers, the core services that Patrol has to deliver, and the other, if you will, competing interests and priorities in the department, MCAT being just one example. So when we do get those figures, right, I then have to look at where do we put those bodies? Do they go to homicide? Do they go to domestic violence? And so it is a bit of a numbers game, but certainly it's more thoughtful than that. And if I could go like this, I would have full capacity in every single one of the units in the Bureau of Investigations. The last thing I'll say is that we are fortunate that the personnel that we do have, as go above and beyond and, do what needs to be done, even with those reduced numbers. Sometimes in order to deliver that high level of service, right, sometimes we do see the increase in overtime, and it's trying to manage all things. So I know that's a very long answer to your question, but I thought
They're very thorough. Yeah, those 14 are acting like 20. And at one point or another, there's a breaking point, right? This is, I'm sure, work that really wears and tears people in a way that I can't possibly understand. But I'm grateful for the work that is being done. And so to me, I understand the numbers game. I don't know that our survivors do, right? I don't know that our community does. And the reason why I'm always piping up about this is because, as you all know, this community needs a squeaky wheel. I'm that squeak. Sometimes it's not very fun to always squeak. I don't want to have to. And so I'd like to see the kind of priority that is given to other kinds of crimes, the same way that those are prioritized, and that gender-based violence is also prioritized.
I would not disagree. And that is also why our partnerships with our advocates are so extremely important, because they allow us to enhance our level of service to our survivors in our community.
Well, that leads me to my next point, which is we are going to lose them, because I think in March you all shared in the report that you were waiting to hear. I think September was when these advocates, the funding for these advocates was going to run out. And so I'm not sure exactly when we're going to lose them. I think Lindsay and Cynthia have shared that somehow they made it somehow work. But what are we going to do? What is the plan for when our advocates, our agencies who are also hurting, can't make it work?
Yeah, and I could speak to that a little bit. So we were, to Lindsay's point, we were informed this week from the Office of Violence on Women that we did not receive the grant for which we had applied. The grant that we have was a 3-year grant. We do presently have, the grant term was extended through September 30th of 2022. We do have some remaining monies, a large portion of which will continue to fund our YWCA advocates. And when we looked internally at service impacts, right, as mentioned, we have a courthouse advocate, we have an in-house advocate at family violence, and then one at sexual assaults. There are some other line items that it does affect as it relates to travel and some overtime to do some operations out of family violence on domestic violence restraining orders. But our plan, to answer your question, and this was developed in concert with our fiscal unit, is number one, we've requested feedback, right, from DOJ on the grant proposal, which was not funded. So that's pending a response. But the 2022 OVW grant solicitation is estimated to be released mid-January of just this next year. We can apply for the grant at that time. And certainly we can have continued conversations about continued funding, possibly through the budget process. So we do have a remaining balance. I think it's roughly around $200,000 to continue funding some of these things through September.
Just to jump in, council member, Deputy Chief Washburn let me know of this issue yesterday. So I was actually just emailing you back right now.
Chief, but gonna circle next week with the chief, Deputy Chief Washburn, and try and have the city manager's office kind of understand what we can look for outside of the building, but certainly can look internally to the department and the administration to ensure that the services continue through the fiscal year, and that we're not interrupting services to the community, you know, during this period. So that'll be a priority for us. We'll do some work and circle back through the mid-year budget process if we need to, or if we can do that administratively, let PISFIS know through one of the operational or bi-monthly operational updates.
And that would be to replace the 3-year funding that they will be missing.
Yeah.
Great. And I'm sure that you all know of all of the grants that are available. It sounds like there's something that's coming up that you will take advantage of, but this is something I think we've all heard going from, you know, the reimagining public safety and how we need to find other agencies that can diffuse and mitigate some of the issues that are happening out in our community that are mental health related. This is also another area where we need advocates who are able to do their part in solving this issue. I mean, you all will capture the bad guy, do the investigative work, but some of that repair and support for the family and the survivor happens with the advocate. And if that doesn't happen, we all know how likely a survivor is to not move through the process. And then our closure rates also get impacted, which is, I won't say that is important as supporting a family, but that's also representative of what the work that we're doing. So anyways, I won't beat a dead horse here. Obviously, I want as many resources as we're able to provide for this segment of our population. That is it. Because of the pandemic and potential because of the intersectionality, so we're finding more, but we know, even anecdotally, there's so much hurt happening right now, and those survivors haven't really come out to share with us. So anyways, thank you for the work. Thank you for all the support that you all provide. Thank you, Cynthia and Lindsay. Lieutenant, I appreciate the report.
Can we get a motion?
Motion to approve.
Second.
Motion and second. Thank you. Just in regards to that last conversation, how much funding are we talking about losing, I guess, from the grant that we thought we were going to get? And then how much funding would it take to say continue the program? Right now, you would say funding would end out or end in March. Is that the timeline?
The grant timeline was extended through September as far as the grant monies running out. I'm not 100% on that. I think the remaining balance for the YWCA is roughly $160,000. The grant, when we received it, was a 3-year grant, and the total budget was $810,000. If you just look at the portion for the Y from that total balance, it was roughly half. So over 3 years with the advocates that we have, it was $415,000. So roughly half of that overall grant over a 3-year term. And it's about $135,000 to $142,000 per year. So per fiscal year, about $140,000, just strictly for that portion of the grant.
And so I'm just trying to get a picture of when we may actually run out of funding to, you know, and then the reason why I'm asking is so that we can see if we can line it up, right, with our opportunities that we may have for either budget discussions or other funding opportunities, right? So just kind of get an idea on when that money's going to run out, what the deadline looks like.
Yeah, and I will look into that, bring that to that conversation, unless somebody else on the line here has when the monies for the advocates would run out in 2022.
I can speak to that in the sense that I imagine it will get us through September. We have had turnover. That's part of kind of what we are struggling with, and I don't know about anybody else, but so we don't want to leave any money on the table. We want to make sure we're utilizing it and spinning it down, but I imagine that would pull us through September.
Okay, so through September of next year, you believe that's when it would run out. Okay, that's a good estimate for now. And again, the reason I asked it just to have an idea of sort of what we're running up against on, trying to identify other resources if need be. And so that's helpful as we will have some other opportunities for discussion at the council. And then otherwise, I want to be able to say thank you for the annual report, and thank you to Councilmember Arenas for being squeaky on this item. Right, there's many things that we have to deal with here at the council, and I think it's important that we have individuals like yourself that can stay on top of different issues more passionately, and so I appreciate that. And I saw your hand go back up. Did you want to follow up? Oh no, I'm sorry. That's from before. Okay. Thank you. So more to discuss ahead that I know we will. Let me say this to the advocates. I know Councilmember Arenas agrees. We want to identify the funding. You are absolutely key to our services that we're providing to survivors, and we can't lose our advocates. And so I think we're gonna make sure that we find we have a deadline now, and so we want to make sure we find the resources to continue that service. And so with that, we do have a motion, and if we can get a roll call vote, please. And
Arenas,
Yes.
Jones, Mahan,
Aye.
Jimenez,
Aye.
Perales,
yes. All right, motion passes unanimously. Thank you very much, everybody, for your participation on that. That'll take us to our last item before open forum, which is item D4, the housing and childcare options for gender-based violence survivors report. And I believe we have Reagan here. Yeah, Reagan, welcome.
Great. Thank you, Chair. Good afternoon, committee members. Reagan Henninger here with the Housing Department. We don't have a presentation today. Our staff report was pretty short and sweet, but I did want to say that the Housing Department has been part of a work group that's been formed to develop a set of recommendations related to increasing housing and childcare options for survivors of gender-based violence. This group has met just once, but we've also formed 3 subcommittees that are focused on increasing emergency shelter options, increasing transitional housing, and the 3rd subcommittee is focused around increasing permanent affordable housing options. And those subcommittees are meeting now, and we hope to have some preliminary recommendations later this spring and anticipate coming back to this committee with those. And with that, I'm available for any questions.
All right, thank you very much. We'll go to members of the public first. And first up, we have Tessa Woodmansey. And as a reminder, this item D4, housing and childcare options for gender-based violence survivors.
Hello. Oh,
we can hear you.
Can
Go
you hear
ahead.
me? Oops, sorry. Can you can
Yes.
hear me now? Oh, you can hear
Yes.
me?
Yes.
All right, sweetie, thank you. You're doing a great job. I wasn't going to talk, but I will. All right. So, we're doing housing and I love that. That you're doing such a good job with your signage. Thank you. Housing and childcare options for gender-based violence survivors report. Housing and childcare options. Oh, okay. So I guess the one thing I was thinking about this issue was the importance of being able to work at home, and that we've made the considerations to say we need to get back in the workplace, back into capitalism, back into consumer, back into buying things, come back downtown, make our restaurants work. All these values are what the problem is. And it's keeping capitalism and consumerism going instead of we need to go in the other direction, which is to degrowth, deconsume. And so when we made these choices to bring everybody back into the workplace, now we're all safe. We got our vaccine, like I call it, lipstick on a pig, because really, as we see, the vaccine isn't a formula for health. I mean, there's a lot that goes into health. And so what it was is that when women worked at home and the parents worked at home, that was a lot more stability for the home. And I saw that over and over. Every time I spoke to anybody, are you working at home? Yeah, I'm working at home. And of course, they had their phones going to their home, which City of San Jose could not figure out, which was terrible. We know why they didn't figure it out, because you didn't want to support it. And, and it's like, that's where the change came. And when we talk about childcare options, that is, it just having the mother at home is what the mothers were reporting to me. It changed the whole vibration in the home. And just, we've lost the mothers mostly. They have gone to work, but it made such a difference. And we need to really consider that.
Okay, thank you. And our next speaker will be call-in user 1.
I'm glad that you guys could help people out, but as I listen to all these meetings, where's all this money going to come from? How are we going to maintain it year after year? And people who unfortunately get stuck in something like this, I mean, it's a bad scene, right? They may still be working, but they've lost their home or not able to go back to it, or an apartment that maybe will be under eviction because people move out and aren't able to pay the rent. So how is it going to stop? And are there plans for people to be able to get on their feet again after the emergency housing? Because how many people do we have to pay for and manage for a very long time? And once again, rightfully so, they're become homeless or whatever without their doing. Someone else made them leave. So how do you rectify all this? And do you have a budget? Is there a 5-year, 10-year, 25-year plan? Because this seems like something that could be never ending. Needed. Don't want to put women and children on the street, that's for sure. But my question is, where's all this money going to come from? And are you promising something that you're not going to be able to deliver? Because right now you guys aren't delivering things even just for regular homeless people. A lot of money is being directed towards it. But, you start reading the newspaper and the news and everything, and people are interviewed, and there's no tiny homes or money or whatever to get these people housed. And how are you going to do it for women and children? And do you have the space? Where is it? Where's the presentation? There's nothing. I'd like to know. And quite frankly, I just don't want people getting false promises and then they're left holding the.
Okay, our last speaker will be Blair Beekman.
Hi, Blair Beekman here. I'll try to be quick. Thank you for this item. And the same as I mentioned in the last item, that roving mental health, vehicle van group that, they travel around Santa Clara County helping with mental health services. They've been really helpful and effective in the past. And would they provide a good service to this sort of item to young people and gender-based issues? And I just thought I would mention it at this time, and they can introduce people into future housing services and such, and offer many services. So thanks for your time.
Thank you, Blair. Bring it back to members of the committee. First up, Councilmember Arenas.
Thank you for the report, and more importantly, thank you for the work that you're doing together with our other partners. So this is a really great time and place to connect all of these great efforts that are happening. It's like we're going to connect all the dots together. You heard earlier today about some of those increases in domestic violence and intimate partner violence, especially with serious bodily injury. I think there was also an increase in the violations of restraining orders in the context of domestic violence. And so one of the barriers that we've heard time and time again for women and men is that they rely economically on that partner, and one of which is their housing. It's the most expensive thing any one of us spend our money on, next to childcare. And so when you don't have these options, that you continue to be in this scenario where the violence only can escalate. And so one of the things that I had just mentioned to Lieutenant Lang, Reagan, was, how do we connect both of these bodies? Obviously, you don't naturally connect, you're not meant to, but I know that there's a lot of decisions that can be helpful for both our police department to learn about what you are all doing and how you're helping inform the other partners in the network about the needs. I know that you found there's a lot of challenges, such as many of the agencies focus on maybe single folks who are out there, who are visually out there in our streets, and not necessarily some of these families who might be couch surfing or just with inadequate housing, maybe in a car somewhere. And so I think you heard maybe some of the conversation earlier. Any thoughts?
Sure, I think it's a good idea to have PD participate perhaps in there's sort of the larger committee, and then we have these 3 subcommittees, but perhaps coming to the larger committee would be helpful. And then I would also say we feel pretty connected to our DV agencies, who all serve on the larger committee, but also serve on the subcommittees. And we have been coordinating on some data requests as well, so that we are using data to inform the recommendations.
Great. Where are you getting your data from?
We've asked, there's a data committee that's part of the DVAC.
Great.
So we ask that committee for data, and they coordinate across all the DVAC agencies.
Interesting. It would be, I think, really strategic of us to connect what the service providers are sharing in terms of trends and what we're seeing, the reports coming in, because this is a crime that's underreported. We know it's underreported. And so we only can see what the calls that come through, but the actual problem of it, it's the iceberg example, right? It is larger. And I think that what we need to do is just maybe connect them either through an information memo or have them visit, like I think maybe, I don't know how often you guys are meeting, quarterly or once a year. How often is the larger group meeting?
We try for quarterly.
Got it. Okay. Well, I think it's like I said, I don't mean to make additional work. I just think that all of this work that we're and the steps that we're taking to improve our systems and ultimately to improve the lives of the folks who have been impacted by violence, I think it only serves us to be strategic and to inform one another of how we're providing that support and what we're seeing, because I think we could all benefit from what the service providers are seeing versus what our police department is seeing, because those are two different perspectives, right? Aside from that, you were all talking about housing, and that's absolutely important. So anyways, I really appreciate it. The only other thing that I was going to ask is maybe if you could provide some of what you, if you could forward that report over to our police department, that all the contacts that you saw
Yeah.
on Zoom today, just so that they can see a little bit of what the conversation that you all have had. And then hopefully we can see one another again when our chair brings together jointly the county and the city, so we can see ultimately all the work that's being done. But in the meantime, I think there's some really good information to share back and forth from.
Yeah, I'll share that report and invite PD to our next larger group committee meeting.
Perfect. And I will move to, I'll make a motion to accept the report. I think I've made every motion. Sorry, guys.
Second.
All right, no worries. We have a motion and a second. I don't see any other hands. Just jumping in, I was curious about the meeting schedule as well. It sounded like you said May was your first meeting. Looks actually in the report May 26th. And then you have another one scheduled. Oh, wait, did you have one on November 4th already?
Yeah, we did have one November 4th.
Okay, so the two meetings then. Okay, and you are planning on meeting quarterly is the hope.
Yep.
Okay, yeah, look forward to the work coming out of this. I know this is early. It is important. I think the first comments are very clear in regards to what we see across the board. We know we have limited funding, and a lot of that funding has been made available for permanent housing. And if we want to sort of shift right and focus on some other areas, there are either we need to get more money or we have trade-offs to debate, right? So so hopefully we can just get a lot more money. Okay, that's it. Thank you for the update, Reagan. We'll do a roll call vote now.
I second that, Chair, for a lot more money.
Yeah.
Arenas,
Yes.
Jones, Mahan,
Aye.
Jimenez.
I think we just lost him.
Oh, okay. Morales.
Yes. Motion passed unanimously with those present. All right, we're on to our last item, which is open forum. And it's just a reminder, it's for items that were not on the agenda today. And first up will be Blair Beekman.
Hi, thank you. Thanks for the meeting today. A reminder that mask use can be really helpful this upcoming holiday time, and that with the vaccine process, good luck to ourselves how we can grow more comfortable with it and be more open in all that it is possible of and capable of doing. And I think open public policies with technology can really help facilitate a very neutral conversations for all sides, if possible. I heard a bit of my initial public comment at the beginning of the meeting. I'm really sorry about that. I was trying to quickly say that there was some really interesting studies and lectures by certain retirement board facilitators. They appear, fairly frequently, and gave a really interesting report at the beginning of the year that we actually could be practicing how to keep inflation ways down in this upcoming year, and start to work towards more inflationary things in 2022. That didn't pan out, and I just wanted to thank that person again, and hopefully I can talk about it a bit more later at another time. He offered some good ideas. Hopefully we can learn from hindsight, and thanks. With 46 seconds, I wanted to try to quickly offer redistricting ideas within the PISPIS committee process. They're going to be coming to you with their ideas and recommendations at this time. I like both the unity and community maps as ways to figure things out. I think the Vine and Willow Street area, I think that should be part of District 7, and we should start really be considering east-west ideas of the future of redistricting, not just now, but in the next 10 years. And with that, we can move District 7 a bit up, almost into the San Jose State area, and to think about the business issues of District 3 that everyone likes so much. They can be patient and just respect that District 7 can really be.
All right, thank you. Next up will be Paul Soto.
Yes, Paul Soto from the Horseshoe. Last night's meeting at the redistricting was just, it was awful. There was no representation for the area in question, which is Gardner, Tinian, Washington, Alma, all that area. There was no representative that was at the table to create those maps. That's number one. Number two is that the city has not used the redlining map as the measure and used it and how you draw those lines, because those lines were drawn using that redlining map. So there's been an unjust allocations of resources that flow from those census maps in the 1940s, 50s, 60s, and 70s. And so to try to come up with some idea, but you're not centering that redlining map and all of the associated economic, political, and social deprivations that resulted from that, you get a situation where you had probably about 20 Asians calling up there and just berating people for defending that on the redlining premise. There's this complete lack of understanding of what happened in these neighborhoods, and whenever somebody does talk about it, it because it's being shared in these open forums, it sounds like it's an opinion and not a fact. And that's because the council has not affirmed that this has happened and that it has a responsibility to do whatever it is they can in order to rectify those injustices.
Next up will be call-in user 1.
Yeah, the redistricting, I mean, quite frankly, they shouldn't have to do anything. It's a one-party city. It's a one-party state. It's a one-party county. So what are you guys worried about? Having to move things around? I mean, the unity map, forget it. That's from Sue Ellenberg, and she's bad news, I could tell you. She's probably the most evil person who is in any city or county government. She's horrible. Whatever she wants, you should be against. But, you know, you guys, you go along to get along. Even the supposed Republicans, they might as well be Democrats. This whole thing is left wing. So if you're going to do it, go with the community map or do nothing, because nothing is going to change, because some of these areas, it's just the way it is. They're just no man's land. Like, moving or gerrymandering it is not going to make it any better or worse. Whatever districts are there, they should be able to make them better. Moving a line is not going to do anything in this modern age. And also, this is coming to an end for a lot of these meetings. And I just want to tell the city, Merry Christmas, and I hope you wish me a Merry Christmas, because you people get paid for it. That includes all the workers, the city council, the fire department, the police department that always wishes us happy holidays. It's Christmas. You're paid for it. And remember who told you, because quite frankly, if you can't wish me a Merry Christmas, you shouldn't be offered the paid holiday or get extra time for it. I'm tired of every single year. Every other holiday is honored but Christmas. And all you guys have to say is happy holidays, because you might offend some people. You know who you are. You know that is the wrong.
All right, thank you, Mr. Sonsini. You like to skip over Thanksgiving, just like my wife. I'll wish you happy Thanksgiving right now. We'll save the Merry Christmases for December. And our last speaker will be Scott Largent.
Thank you. Good afternoon, everyone. Scott Largent. It is, excuse me, it's really great to hear the public chiming in these days, and the feedback is it's dynamite. I agree with a lot of what the public commenters have to say, and we're very frustrated about what's happening in the city of San Jose. I kind of kept a distance away from a lot of these San Jose meetings. I went to primarily county and state committees, and now I'm trying to kind of dive in a little more, actively participate, and in a way, it's kind of pulling back that scab in a way. I brought it up earlier that I still own my motorhome. Okay, that was supposedly auctioned off. There was some lien sale, and it turns out that the state of California tells me that it's still my vehicle, that a proper lien sale was never done. Now, I met with you, Raul Perales, and discussed my belongings, my father's ashes, my life's work, my tools. Did the same thing with you, Chief Mata. Begged and pleaded for you guys to do something, do the right thing. Hundreds of people on our streets went through exactly what I went through at the hands of Courtesy and Motto's Tow. Are you guys related to these people? Is this your uncle or your aunt's business? I don't get it. They're now committing aggravated perjury, okay? They're supplying documents that are forged, that went through your code enforcement department. Nothing was ever done about it. Now, why are you guys not going after these people? Why aren't you doing the right thing? And even if it's not for me and my motorhome, what about the hundreds of other people that are over there in the crash zone right now that got bent over by this city? You guys need to start doing the right thing. And Councilman Perales, you need to get out there and start doing.
Thanks, Scott. It was nice to see you during the Veterans Day Parade. And happy Thanksgiving to everybody. We'll adjourn our meeting.